Anyway, with that, Todd, I will hand this over to you, and welcome. Thank you very much.
All right, thank you, thank you. Let me get this started up here. Okay, so what I wanted to do today, can everybody hear me okay? Is just kind of walk you through the Affordable Care Act and the Patient Protection and Affordable Care Act. It actually is rolled out over several years. It takes 8 years for this act to actually be fully implemented. So what I want to do today is just kind of walk you through year by year so you know what has happened in the past, kind of what's happening right now, and what's going to happen in the future as well. This is your new healthcare system. Actually, Congressman Brady's office, when the bill got passed, he handed it to his staff, and they graphed it all out. And if you'll see right in the center there, the Health and Human Services, she kind of drives everything. So the whole philosophy, the whole thinking behind what's going to happen with your health care is driven by Health and Human Services and all these other agencies. And one of my concerns is most of these agencies are appointed officials. We don't elect them. We elect the people that appoint them. So we don't really have main control over people making those decisions. Some terms that you need to know. You may or may not have seen these terms. The first one is a grandfathered health plan. Some of you may work for companies that have what's called a grandfathered health plan. When the act got passed, as it got rolled out, there were certain things that had to start showing up in your health insurance plan. If your employer decided not to include all those things, they could grandfather the plan. So that way they kept their old plan, they didn't have to make the adjustments. The problem is if you grandfather your plan, you do one little thing and you have to change the whole plan. So I don't see a lot of these grandfathered health plans, but it's a term you may see or hear about when you're reading about this. Pre-existing condition. We hear a lot about folks with pre-existing conditions that can't get insurance. Well, a pre-existing condition in the state of Texas is a disease or a condition for which medical advice, diagnosis, care, or treatment was recommended or received within the 6-month period prior to enrollment date. Which means if you were being treated for something and you hadn't seen a doctor, you hadn't taken any medication 6 months prior to the health insurance plan, you don't have a pre-existing condition, okay? Pre-existing condition is basically you've got an issue and you try to get health insurance to cover that condition. And then there's a pre-existing condition clause. So basically if you had this issue, you've never had insurance before and you got health insurance, typically on individual plans and small employer plans, they're not going to cover that condition for 12 months. After 12 months, it's going to be covered just like any other illness. The interesting thing is for large employer plans, so group health plans that have 50 or more employees, there's no pre-existing condition clauses. So that whole thing about pre-X not being able to get insurance, if you worked for a large employer, it's not really an issue with that. Guarantee issue medical plan. So what this means is if I had an issue going through cancer treatment or something right now and I tried to get individual insurance, they would decline me because I've got a condition and they don't want to cover that condition because it would cost a lot of money to cover that. So what we're going to look at going down the road is a guaranteed issue medical plan. So if I've got something going on, I can get health insurance. They might raise my rate, they might make it more expensive for me, but they'll cover that and they'll guarantee me the ability to get health insurance. Another thing you may have heard about, this was last year, the medical loss ratio. Basically with the act, what the government's doing now is they're regulating how much profit health insurance companies can make. So basically the medical loss ratio, what they look at is if you send $1 into the insurance company in premiums, the insurance company has to pay out a certain amount of that dollar, okay? So if they don't pay out enough of that dollar in premium for your medical claims, they have to send you a check back, called a medical loss ratio. So what they're trying to do is they're trying to control how much money the insurance companies can keep for developing websites, customer service, and all those other types of things. It's limited to 15 or 20% of their profit. Or of their, not their profit, the money that they take in. And then also annual and lifetime benefit maximums. I don't know if you guys remember on some of the health insurance plans way back when you were looking through it and it would say you've got $1 million lifetime or you've got $2 million lifetime max. Essentially what that meant was if you had a $5 million claim and you had an insurance policy that had a $2 million lifetime maximum, you would run out of benefit, okay? So they got rid of those, and this was kind of a window dressing thing, because if you think about it, most of the insurance companies are getting a 40 to 50% discount on your medical treatment with the hospitals and the doctors. So to go through a $5 million lifetime maximum, you would have to have $10 million in claims. So it was kind of it was a feel-good benefit where they pulled those out. But you have to price for that too. So you have to adjust your premiums to cover those things. All right? So just some terms that you'll kind of see, kind of the core terms with the healthcare reform law.
The most sacred thing I do is care and provide for my workers, my family. I give them money. I give them food. Not directly, but through the money. I heal them. Today, I am in charge of picking a great new healthcare plan, right? That's what this is all about. Does that make me their doctor? Yes, in a way. Yeah, like a specialist.
Okay, so what happened in 2010? So we're going to kind of go back to the beginning of the law. March 23rd of 2010 was when the act was signed into law. And then what they did is they implemented a small business tax credit back to January 1st of 2010. So if you were an employer with less than 50 employees, you could actually, if you met all the parameters, you could apply for some tax credits to help pay for your health insurance. That small business tax credit was good for a couple of years, but what they were trying to do is to entice employers to go into the exchanges, because in 2014, the only way you can get that tax credit is to go into the health insurance exchange and buy your health insurance. So imagine if you're an employer, you can get like a 35% credit off of your health insurance premium that you're paying on behalf of your employees. And then the only way you can keep that 35% discount is to have to buy through the exchanges. So it kind of forces you into that exchange. So it's like a little carrot that they dangled in front. I've worked with a bunch of clients, and I've had probably 1 out of 40 that qualified for that tax credit, because it's a real low income threshold and all these different things that you have to qualify for. Also, January 1st of 2010, the government set aside $5 billion to fund claims for a pre-existing condition medical plan. So if you didn't have insurance for 6 months or more, and you had a pre-existing condition, and you couldn't get insurance through the individual market or through your employer, you could actually join the federal high-risk insurance plan, and everything would be covered from day one. So if you had cancer treatments, you could get this insurance and your cancer would be covered from the day that policy started. They're no longer accepting enrollees. They've already run out of money, claims money. So $5 billion went towards covering those. To give you an example of what kind of claims they were looking at, my typical employer has an average employee claim of for the year of between $1,000 and $2,000 per person in that company. This plan was averaging about $35,000 a year in claims. So big claims going through there. And then also by December 31st of 2010, the HHS and the National Association of Insurance Commissioners were supposed to determine for that medical loss ratio calculation what goes on the claims side and what goes on the administrative side. And that was a huge battle, probably drug out for 3 or 4 months past the due date, trying to figure out, okay, what's going to go into this, and on the claim side, what's going to go on to the administration side. Okay, and then also September 23rd of 2010, they got rid of the lifetime and annual limits for medical plans. So as medical plans renewed, they would have to go to an unlimited benefit. And one of the plans that got affected by this was called a limited benefit plan. So you may have heard in the news where like McDonald's and Walmart had a lot of employees losing their health insurance. Well, there are some plans that are very low cost, I mean $85 to $100 a month to cover yourself, that give you a limited amount of benefit. So you get $50,000 or $100,000 worth of benefits every year. But what it does is it makes affordable coverage for folks that couldn't afford coverage otherwise. So they've got something. Well, this act made those plans illegal. And so as of 2014, they're all going to be going away. Also, they prevented rescissions. So in some states, in some cases, people that got big major claims, the insurance companies would pull that person's insurance. I haven't seen that happen in Texas, but I guess it happened in some other states where if you got cancer or something like that, they said, guess what? We're not going to cover that. And they just pulled the policy. They would find some loophole or something. Also, preventive care started being covered at 100%, which I think is a good thing, because if you catch stuff early, then it's going to prevent stuff down the road. So as plans renewed in 2010, your annual well womans, your physicals, checkups for kids, immunizations for kids, were all covered at 100% with nothing out of your pocket. Okay. Dependent coverage went to age 26. So if you had a child, you could cover them until age 26. They could be married, they could have a job, and they could still be on the plan. The interesting thing is Texas passed dependents to age 25 17 years ago. So we've had this rule for a long, long time. And also they eliminated the pre-existing clause for kids under 19. So if there was a child that had a pre-existing condition, they could get insurance and it would cover everything from day one. What happened within days of that going into effect, insurance companies stopped writing insurance on kids. So if you've got, if you're trying to just find health insurance just on your kiddo, you can't do it. Blue Cross has rolled out a plan that started about 6 months ago where you can sign up your kids, but other than that, there's no child-only coverage really available because they can't price for it. They don't know, what kind of claims they're going to get. And then also plans had to choose whether they're going to be grandfathered or follow all the new rules of the plan design. All right, so 2011 used to be, how many of you guys have HSA accounts or flexible spending accounts at work? A few of y'all? It used to be you could go and get over-the-counter medication, so Advil or cough medication or those types of things, and use your HSA money on that. Well, what they did is they said, you can't do that anymore without a prescription from your physician. So you had to go to the doctor, get a prescription for your Advil or your prescription for your cough medicine, then take it to the pharmacy, and then you could use your HSA money or your flexible spending account money on it. What happened was, of course, healthcare went up because everybody was going and spending $60 at the doctor to get a prescription for their Advil. W-2 reporting on the value of benefits. I don't know if any of you guys saw on your W-2s this year. Some of you may have had a line on there where it said, here's the value of the benefits that your employer paid for you. So if your employer is paying 100% of your own employee-only cost for your medical, they total that up and they put it on a line on your W-2. The IRS is not going to be taxing you on that yet. But what they're doing is they're tracking that. They're starting their tracking mechanisms because in 2014 we're all going to be required to have health insurance. So if Jim's W-2 says 0 on that box, that notifies the IRS to do a little bit more investigation on Jim to see if he's got health care on his own somewhere. So it's kind of these tracking mechanisms. They also rolled out a class program, which was like a long-term care, federally funded long-term care. They ended up scrapping that pretty quick because they found out that 1, nobody wanted it, and 2, it was going to be really expensive. So that got terminated. And then if you used your health savings account money to buy a bass boat, the penalty went from 10% to 20%. So if you used it for stuff that wasn't qualified health care expenses, then that penalty went up on that. And then the medical loss ratio requirements kicked in, so insurance companies started having to look at how much money they took in versus how much money they spent on claims. And they have to spend 85 cents out of every dollar for large employer plans, and 20 cents out of every dollar, or 80 cents out of every dollar they take in on small employer plans. And then individual plans started renewing with all the new benefits as well. So all the preventive care and all those types of things, they started renewing with reform compliant designs. Oh, wait, there's more. So March 23rd of 2012, employers that offer medical plans have to hand out a summary of benefits and coverage. And it was intended to be, I don't know if when you guys go through open enrollment every year or when you get your new insurance policy, you get that real confusing document that has like co-insurance and deductibles and co-pays and all those things. And if you move from Aetna to Blue Cross, it's a completely different document. It's laid out completely different, so you have to hunt for all the information on it. So what the intent was to make a document that was the same for every insurance company. So no matter who you were with, it all looked the same way. So that way you could find everything. Well, it went from being a nice, tidy 4-page document to a 16-page document that even I can't figure out, because it's all question and answer format. So anyway, employers are supposed to hand those out, and insurance companies are supposed to hand those out too. Now, January 1 of 2013, that's when we start getting hit with tax changes. If you are an individual that earns more than $200,000, or if you're filing jointly and you earn more than $250,000, there's an increase in your Medicare tax of 0.9%. So you have to pay a little bit higher Medicare tax on the amounts over that $200,000. There's a 3.8% unearned income tax for high wage earners. So if you've got rental property, if you have dividends and those types of unearned income, if you earn over the $200,000, there's an additional tax on the income over that amount too, to help fund this. And then here's an interesting one: the increase in the threshold for itemized deduction of medical expenses. I talked to a lot of folks that they add up all their receipts from their medical care. So here's how much I paid towards my deductible, here's how much I paid towards my prescriptions, here's how much I paid towards everything. And used to be, if that amount was more than 7.5% of your adjusted gross income, you could write off that amount that was over that. Well, now they've bumped it up to 10%. So you can write off less, which this really hits folks that are on fixed incomes and folks that are low income that are trying to write off as much as they can on their taxes. So that is bumped up. And then flexible spending accounts, if any of you guys have flexible spending accounts at work, they've been lowered to $2,500. It used to be unlimited, and most of the ones I saw, you could set aside $5,000 pre-tax to spend on eyeglasses and your deductibles and all that stuff. Now they've capped that at $2,500. So it's reducing the amount that you can set aside pre-tax for that. Okay. And then also, March 1st of 2013, employers were supposed to notify all their employees that these health insurance exchanges are going to be available in 2014. That's actually been postponed for several months because they're still trying to figure out what that document's supposed to look like. So, so that's been postponed. Like I said, there's stuff that got passed in the law, and as we go, they keep changing it and moving deadlines and tweaking this and tweaking that. So it's a constant battle, just watching to see, you know, what the changes are going to be.
So which health plan have you decided on?
I am going to go with the best, Jan. I am going to go with the one with the acupuncture, therapeutic massage, you know, the works.
Wait, acupuncture?
Mm-hmm.
None of the plans have acupuncture. Have you looked at them closely, Michael?
Oh, well, I think it was you who didn't look closely enough at the gold plan.
The gold plan.
Yeah.
I'm not even on that plan.
Well, I'd recommend it. It's very good.
All right, so 2014 is when a lot of the big things happen. I mean, up until now, you've had, you know, some changes here, some changes there, additional taxes, but 2014 is when it's really going to get difficult and really going to get tricky. The first thing that happens, the state and federally based exchanges are supposed to be open and up and running, and basically what these are going to be websites that you can go to help to purchase insurance. Chambers of Commerce may have offices to do that, and they're going to be staffed by folks called navigators. And their job is to walk you through the process, to help you pick the plan, help you apply for any tax credits if they're available, help you apply for Medicaid if that's a solution for you. So the federal and state exchanges are supposed to be open soon, and I'm going to talk a little bit more about those kind of towards the end with some recent stuff that I was sharing with Julie on those. Also, the shared responsibility fee is going to kick in, and this has a lot of employers just shaking in their boots. Essentially what it is if you're an employer with more than 50 employees and you don't offer a health plan, or if you offer a health plan that doesn't have all the bells and whistles in it and it's not grandfathered, or if you don't offer affordable care, affordable health insurance. And what that means is if the amount that the employee has to pay for their own coverage is more than 9.5% of their household income, it's unaffordable, okay? So if you don't do any of those three things, and one person from your company goes to the exchange and buys health insurance and uses a tax credit and gets a subsidy, the employer gets hit with a fine of $2,000 for every employee over the first 30, and then for each person that gets subsidies in that company, they get an extra $1,000 fine on that person. Now, to give you an example, I've got a client that has about 280 employees. They don't offer anything right now. They're a Medicaid home health, and they're like, Todd, we get reimbursed by the government. We don't really have a margin to cover health insurance. So we ran through the calculations, and if they don't do something, they're looking at $682,000 in fees to the government. That's not tax deductible, so it's really about $800,000 to this company. So if they don't put in some health insurance, they're looking at another 800 grand to the bottom line that they got to come up with. So working with another client that has about 85 employees, and he's looking at about $150,000. He was like, Todd, I was thinking about opening up another restaurant, and I don't think I'm going to do it now because I'm looking at another $150,000 to my bottom line. So they're really putting the pressure on the employers to offer health insurance and to subsidize part of the health insurance. So it's really, really difficult, and it's a huge problem. Daily I'm working on this with clients, trying to find solutions for this. Also, no pre-existing conditions for everybody starts. So basically, you break your leg and you don't have any insurance, you stop off at the store, you buy some insurance, and you go get your leg fixed. So there's no pre-existing condition clauses, which is a big thing because it's kind of like the insurance companies are trying to price for something that they don't know about. You know, right now, the way they set the rates is they kind of know what your medical conditions are and they know what's going on in the company. And they've got all these protections in place that helps them set their rates. Well, if there's no pre-existing, you don't know if there's somebody sitting at home that has a big claim waiting to happen. So no pre-ex for everybody is going to start in 2014. Also, employers that right now is for employers that have over 250 employees. There's going to be some reporting they have to do back to the IRS that tells them what type of plan they've got, how many employees are on it, what the cost is. They're kind of working through the reporting requirements right now. It's in the comment period with the IRS, but eventually they're going to start reporting stuff to the IRS about who's on their plan, what kind of plan we've got. So in addition to that W-2 line item, Uncle Sam's also going to get a list of everybody on your employer's health plan so that they know who's got insurance and who doesn't through that employer. Also, the individual mandate begins, and I worded this, all citizens must have minimum essential coverage or pay a penalty. So if I decide not to go out and buy health insurance, or I go out and I buy some policy that's not deemed minimum essential coverage, at the end of the year I'm going to get a letter from the IRS that says, you don't have health insurance, and I'm going to have to pay a penalty for that health insurance, for not having health insurance. So in 2014, that penalty, if I don't have health insurance, will be $95 for myself, $95 for my spouse, and then I pay half that amount for each child in my household, up to a certain amount. So that's an additional penalty. Next year it's going to go up to $300 and something per person. Then the following year it's going to go up to $695 per person, or up to 1 to 2% of your income. So there's going to be some additional, it's like saying, I've heard it before, you know, if you don't go buy broccoli, we're going to fine you. Well, if you don't go and buy a product, you're going to get a fine from the IRS. It's just they want everybody to have health insurance. Interestingly enough, though, if you don't pay the penalty, they can't come after your house, they can't come after your bank accounts, they can't come after your car. The only way that they can get that money is through any tax returns, tax refunds you may have coming to you. Okay? So that's the only way they can come after that. The insurer fees and taxes begin as well, and I'll kind of show you how that's going to impact the premiums here in just a second. But there's several different types of taxes and fees that the insurance companies are going to have to pay, and guess how they're going to do it? They're going to pass it through to you. They're going to add a little bit to your premium to pay these things. The first one is a health insurer fee, because apparently, health insurance companies are going to get all this new business because everybody's going to go rush out and buy their insurance. They're going to pay an $8 billion fee in 2014, and it's going to go up to $14.3 billion in 2018. It's just purely an insurance fee for selling insurance. The other one is a transitional reinsurance program, and what reinsurance is it's a way to cover catastrophic claims. So as I mentioned before, there's going to be no pre-existing conditions for everybody, and there's going to be some folks that rush out and buy insurance to cover their heart condition or their cancer or whatever, and it's going to be covered from day one. So what they're going to do is they're going to get money from all the insurance companies. They're going to build up a $25 billion pool to pay for these catastrophic claims. So the federal government will hold on this money. The insurance companies can apply for reimbursement back. So it's kind of like that $5 billion money they set aside for the federal plan. There's going to be a $25 billion pool to help cover some of these claims. Which we're going to fund other things while they're waiting. The other fee, there's going to be a patient-centered outcomes research fee. Essentially, there's a board that's been put together by the federal government, and what they're going to be studying is there's 5 ways to treat a condition. This one way is the least expensive with the best outcome, so that's the one that's going to be covered. What's the best way for patients to interact with physicians? There's going to be all kinds of research. So what this board is doing is, if you're a research company, you can apply for grants and money from this board. And then through the insurance companies, they're going to send this board money to do this patient-centered research fee. Okay? So I don't know where that's going to go, whether it's going to be when do we cut off treatment based on your age, when do we start treatment based on your age, all these different patient-centered outcomes that are going to be researched for us. Also, starting in 2014, there's going to be a minimum essential benefits package that's going to be built into your health insurance. So basically, there's going to be things that are going to be required to be covered in your health insurance. So starting next year, you're going to see things like pediatric dentistry for kids to go in and get their teeth checked with nothing out of your pocket. There's going to be eyeglasses and frames that you can go get with nothing out of your pocket. Maternity is going to be covered on individual plans, and on all qualifying medical plans, maternity is going to be covered. When I first got in the business and somebody bought an individual medical plan, they could buy a rider to cover maternity. On individual plans right now, maternity isn't covered. That rider was about a $5,000 to $7,000 increase to the premium to cover maternity, and that's, oddly enough, that's about the cost of a standard delivery. So if you think about it, if every plan is going to cover maternity now, whether you need it or not, it's going to be in there. So there's going to be kind of that socialized medicine concept. Breast pumps are covered at 100% now, starting in 2014. So everybody's chipping in a little bit to buy everybody else's, deliveries and all those types of things. Also, there was a thing called a free choice voucher, which got repealed. I'm not going to really go into that. It was an employer thing. And automatic enrollment for employers with more than 200 employees. So somewhere down the line, they've postponed it, but within the next year or so, if you work for a company with more than 200 employees, when you hire on there, they're going to automatically enroll you in the medical plan, unless you tell them, I don't want the medical plan. Okay, so it's kind of a reverse enrollment. Instead of them saying, do you want it, you're going to get it unless you don't want it, and then you have to unenroll from it. Okay, so I've already been seeing this on some of the proposals I get, and when I'm looking at insurance proposals for my clients, they all have a little footnote at the bottom. If the Obamacare stands, next year we will begin charging a 2 to 3% premium increase to cover the health insurer fees. I've seen this on medical, dental, and vision premiums. So they're already going to start building in a couple percentage points to your cost every month to help pay for these insurer fees. There's going to be a $1 to $2 premium increase for everybody for the patient-centered outcome. So everybody's going to chip in $1 or $2 in their premiums to help fund this. And there's going to be a $5.25 premium increase for the reinsurance contribution program. I don't know if you guys have seen in the news where they're talking about that $63 figure that's going to make insurance go up $63. That's what this is. So it's $5.25. It's $63 a year. So that's all going to go into that reinsurance, that $25 billion pool. So right there, we're looking at about, what, $7 a month plus another 3% for the cost to go up. Also, for small employers, so if you work at a company with 50 or fewer employees, the highest deductible you can have on your medical plan is $2,000. Okay, most of my clients have between a $2,000 and $5,000 deductible plan, and we do some things around it to help lower the cost for the employees, but they're not going to be able to be higher than $2,000. Well, the deductible is what controls the cost of your plan. The higher the deductible, the lower the cost. The lower the deductible, the higher the cost. The health insurance companies, I'm getting memos every day, and we actually had a rollout meeting with United Healthcare. They're developing entire strategies on how to deal with this $2,000 deductible issue, because they can see it driving the premiums way up. So things like early renewal, copay only plans, and those types of things to help get around this $2,000 fee, or the $2,000 deductible issue. All right, so that's a big, big thing in the insurer's eyes. So it's going to be another thing we're going to have to deal with going forward. And then here's the other thing. This is like modified community rating is a major shift in how underwriters are going to set the price for their products. Right now, when we go out and get insurance quotes, we look at what for example, for a group plan, we look at what the employer does, where the employees live, what kind of medical conditions are going on within the group, and then we take that information and the ages of the employees, and that's how we get our rates. It gives the underwriters a real clear picture of what's going on. Modified community rating is how Canada and England and a lot of the socialized medicine countries set their pricing. So what they're going to do, instead of doing all those things, the only way they can set the price is where you live, how many people in your family, and if you smoke or not. And that's going to how they set their rating. So they're basically going to divide Texas into 7 different rating areas. And the insurance companies can set up these different rating areas. They're going to pull all the medical pricing data from those areas. That's how they're going to set their insurance rates. So imagine if you watch your diet and you're very, very healthy, it's not going to really matter because it's all based on the whole area where you live. So anyway, it's a major, major shift. I haven't seen any pricing yet. The insurance companies were kind of waiting for this last election to see who ended up in office, and now they're scrambling. So we should start seeing some pricing for this modified community rating coming out pretty soon.
Did you say what the, is there going to be a deductible limit for private plans?
No, so the deductible limit for private plans will be different. Yeah, and that's going to be set on minimum essential coverage. So the one I've seen in Texas, so the minimum plan for the exchanges, they're kind of working through it right now. They're basing it on a Blue Cross plan that has a $3,000 deductible with 80% coverage after that. Will be kind of like the bare bones plan, and it's got co-pays and those types of things built in. So okay. That's just for small employer plans. Click through all these bouncing things again. Do you want me to go through these? Any questions so far? I'm either doing really good or putting you all to sleep. So.
I have a question.
Yes.
Back on the fee that the employer was going to have to pay.
Yeah.
Is that only on full-time employees? So for the employer to circumvent that horrendous fee, he could cut everybody back to part-time?
Sure. Yeah, good question. So she asked, is the fee only on full-time employees? And yes, it is. It's there's 2 things that happen. So a full-time employee would be an employee that works 30 hours a week or more. Okay? So one way around that is to take everybody to part-time. So everybody would work under 30 hours a week, and then you don't have to deal with offering health insurance because everybody's part-time. The other thing they look at is, say you've got 45 employees that are full-time working 30 hours or more, and then you have another 20 employees that are working part-time, well, you have to run a calculation and get a full-time employee equivalent to see if you're going to be subject to that fee or not. But then the fee is based on all your full-time employees. And there's been thoughts of, well, I've got 200 employees, I'm going to break it into 4 companies of 50 people apiece. Well, they've got you there because they do this thing called a common ownership calculation. So if you're still the owner of those 4 companies, it's still one company. Or if you give half the company to your son, it's still that one company because you're related to that person. So they've got you. I had a friend that moved over here from France, and he was a businessman over there, and he said you wouldn't believe their magic number was 50, and he said everybody has 49 employees. You know, so yeah, good question.
Dwight,
Knock, please. Please, knock. This is an office.
It says workspace.
Same thing.
If it's the same thing, then why track workspace?
Just knock, please. Okay, a sign of respect for your superior.
You are not my superior.
Oh, gee, then why do I have an office?
I thought it was a workspace.
okay.
Fine.
Dwight, are you really in charge of picking the healthcare plan?
Yes, and my decision is final.
This is a ridiculously awful plan because you cut everything.
Oh, times are tough, Pam. Deal with
You
it.
cut more than you had to, didn't you?
Sure.
Well, why did you do that? You work here. Don't you want good insurance?
Don't need it. Never been sick. Perfect immune system.
Okay, well, if you've never been sick, then you don't have any antibodies.
I don't need them. Superior genes. I'm a shrew. And superior brain power. Through concentration, I can raise and lower my cholesterol at will.
Why would you want to raise your cholesterol?
So I can lower it.
Those are about the only clips I could show from this. So. One of my favorites. All right, so 2015, 2017 are kind of ho-hum. The insurance companies are going to keep paying those insurer fees and keep building up that pot for the reinsurance. 2017 they pay 13.9, 2018 14.3 billion. And then in 2018 the high value plan excise tax is established. And what the high value plan is this is for what they call Cadillac medical plans, which have like real low deductibles or real low copays, but they're really expensive. If in 2018 you're on a medical plan that costs more than $10,200 in premium for the year as an individual, or $27,500 for a family, it's going to be considered high value, and the insurance company is going to get assessed a penalty of 40% of the amount of money premium over that $10,000. Well, we just went through all the different stuff that's going to happen, you know, all the new benefits and all the pre-X. I wouldn't be surprised if we don't start hitting that number pretty soon. I mean, that's what, like $800 a month for an employee only or so. So they've got this in, and you know, school plans, union plans have real rich benefits, and they're very expensive. So I don't know if this is going to stick around, but right now it's still there in the bill, the high value plan tax. All right, so what can I do? As an employer, what you want to do is you want to check your size. How many employees do I have? And you're going to want to run a calculation called a full-time equivalent calculation. So you take the number of full-time employees, plus you run a calculation on the number of part-time employees to see if you're over that 50 mark, whether you're going to be subject to that penalty or not, okay? Also, get the reports that you're due from the insurance company and dig into them. State of Texas passed a law several years ago called House Bill 2015. An employer health plan down to 2 people can get a report from the insurance company that shows month by month people on the plan, month by month claims paid, and any large claims over $15,000, which is and it's all de-identified. It doesn't say, oh, Jim down the hall has a big claim. You don't know who it is, you just know that the claim is out there. But what it does is it lets you know 2 things. One, am I getting my money's worth? Am I, paying too much for my insurance that I'm not using? And 2, is there something going on in my company that maybe I need to do some communication for, some wellness communications, stress some mammograms, or those types of things. And it also just lets you know what's going on with your health plan. Also, review your plans now and get creative. So if you know you're going to be subject to that $2,000 deductible deal, start looking at ways that you can get to a $2,000 deductible and still keep the premium down. Also look at self-funding your medical plan. And what self-funding is basically the employer holds on to the claims money, and they hire an administration company to handle the claims and pay the claims for the doctors and the hospitals, and the employer holds on to that claims fund. And you've got some insurance protections in there that protects that money. But the thing with self-funded plans is there are some rules that are in the law that self-funded plans don't have to comply with. Because interestingly enough, the way the government views fully insured medical plans is they're the evil insurance company trying to make money off of all of our health care. Self-funded plans are viewed as not-for-profit plans because it's an employer trying to control their claims. So there's certain things you can do in a self-funded plan that you can't in the other ones. And just to give you an idea of how popular these are getting, used to be about 3 years ago, you had to have 100 or more employees to self-fund your benefits. I just got a notice 2 weeks ago that there's a couple companies that are writing self-funded plans down to 5 employees. Yeah, just to get around all these different laws. So, so take a look at that. Also, get your plan documents in order. I got an email from a friend of mine who's a broker in Chicago, and he's been in the business a lot longer than I have. And he said, Todd, I just had my first benefit audit. And an IRS auditor called one of his clients and said, we want to see everything about your health plan. He says, I went in there and they wanted to see the plan documents, they wanted to see the summary plan description, they wanted to see when everything went out, they wanted to see what the rates were, they wanted to see who was on the plan. They went through everything. So make sure you got your ducks in a row and got your documents in order, just in case those audits start happening. All right? Also, update your payroll system so you're putting all the right information on your W-2s, and also run the calculations for the affordable coverage calculation. So you're going to want to take some calculations off your payroll to see how much money can the employee pay and still meet that 9.5% of their income calculation. Make sure you're offering affordable coverage. Also look for tax credits. There may be some tax credits available through that tax credit deal. And also, you know, it's always good to meet with a benefit advisor and kind of walk through those things. You know, guys like me, we do this stuff day in and day out, and you're always, you know, seeing the new things and seeing the latest with the legislation. And then for individuals, do your homework. Down the road, you're going to have to know what coinsurance is, what deductibles are, what co-pays are, because you may be dealing with a navigator that's like going to get your insurance license renewed. So you're going to have to... Huh? Driver's license. Oh, driver's license, not insurance license. Yeah. Sorry, you guys don't want that. Driver's license. Read your handouts and your plan documents, because there's going to be all kinds of things that are going to be covered under these medical plans coming forward that you don't want to miss out on any benefits that are in there. You know, eyeglasses and pediatric dentistry. You know, if I'm going to pay for it, might as well use it. If we've got to have it, you know, look at your plan documents and see what's in there. Another good thing to do is look how you've used your plan in the last couple of years. So count up your doctor visits, count up your hospital charges, those types of things, because there's still going to be a choice of different medical plans. So look at how you've used healthcare in the past, and don't overbuy your health insurance. You know, maybe go with a higher deductible or a lower deductible, whatever fits your utilization the best. Look for individual tax credits, because those may be available. And purchase coverage that fits your needs, and watch those over-the-counter medications. Make sure you get prescriptions for those so you don't get dinged at the end of the year for that. Okay? If you're on an individual plan, the insurance companies are going to offer you what's going to fit. You basically take what they give you, so you don't have to worry about having to, you know, make adjustments or change your plan around or meet any rules. They're going to give you what you're supposed to get. All right. Okay, and on my website, it's basically a blog where I keep a lot of updated information. So there's some information on these calculations and stuff like that. So if you're interested and you love reading insurance stuff just like me, there you go. So, all right, that's it. Do you guys have any more questions? Oh, yeah. Thank you. See, that's why I brought her. She can remind me. So we talked about the state-based health exchanges and the federally based health exchanges, and essentially each state in the union can choose whether they're going to run their own health insurance exchange or have the federal government come in and run the health exchange. Okay? Texas has chosen to have the federal government come in and run the health insurance exchange instead of us doing it ourselves. In the law, it is very clear that tax subsidies and tax credits are only available to state-run exchanges. They're not available in federally run exchanges, okay? So what triggers all those employer penalties? If somebody goes out and gets a tax credit through the exchange, that's what triggers the penalties. Well, the way the law was written, there's no penalty, there's no tax credits available under that federal exchange. So a couple weeks ago, I was at Rotary, and I was talking with Kevin Brady after the Rotary Club, and I came up and I said, hey, this is what I understand. There's no tax credits available for federal exchanges, but they're under the state exchanges, and that affects all these employer penalties. And he's like, yes, we're very familiar with that. I know exactly what you're talking about. We're going to have a congressional hearing about it. And Patty rushed back to her computer, and we were trying to find out when that hearing was. We never found anything on it. But he seemed very concerned about it. And then a couple weeks later, I was at a Conroe Chamber meeting where he had kind of a round table where everybody could ask questions. Well, I asked that same question and phrased it so everybody in the audience could hear. And he says, well, yeah, that's going to be kind of a tough fight, and just kind of shrugged off the question, and on we went to the next thing. So it's not getting any traction up there, but if we can hold their feet to the fire on these tax credit issues, it may give employers a lot of breathing room. And also, we would kill Obamacare, because you're going to have, basically right now, only about half of the states have decided to run their own state-based exchange. Most of the states are doing federally based exchanges. So if we can hold that tax credit rule where there's no tax credits and subsidies, then it might do some damage. So anyway.